Hello and welcome to this special winter edition and the final 2025 episode of Medical Imaging Matters, the official podcast of AHRA, the Association for Medical Imaging Management. I'm Jason Newmark, AHRA's Executive Director and your host. So winter, it's officially here. And for me in New England, that means snow's falling, ski mountains are opening, kids are sliding down hills and launching snowballs. And let's be honest, it's really all about the NFL playoffs just around the corner. Go Patriots! So anyway, I could not be more excited about this end-of-year episode. And today I'm joined by three very close friends and colleagues for a thoughtful conversation about culture, about team engagement and patient experience, and at the heart of it all, the immeasurable power of human connection. That's both in our work and our personal lives. So real connections, those are built on trust, and those deepen engagement, and they fuel satisfaction for our teams, our patients, our families, our friends, and let's be honest, for ourselves. So as we race through the holiday season and wrap up the year, leaning into these connections is what it's really all about. It's the not-so-secret ingredient that re-energizes our passion for the work we do every day and the relationships that we hold close to us all year long. So my guests today are Lisa Wood, the Executive Director of Diagnostics and Therapeutics at Hancock Health in Indiana, and the Director on AHRA's Education Foundation Board of Directors. I also have Sherry Manuel, the Chief Commercial Officer of Imaging for US and Canada for GE Healthcare. And finally, we have Jake Poore, the founder and president of Integrated Loyalty Systems, a company dedicated to elevating the human side of healthcare. So listeners, why not settle in by the fireplace or find another place with a great view and take a moment to truly reflect on the power of connections, how they've shaped your year, how they've supported others, and how they will continue to inspire your work and your life in the year ahead. On to the show. All right, gang, I am so excited to have three really close friends and colleagues of mine here today with us. We're going to be talking about the power of connections and the importance of really getting to know your team, supporting your teams, how that translates to patient experience, how that helps you retain and recruit your team members, you name it. But I'm not the expert. I'm going to have the expert speak. So why don't we start and just have some introductions? Just by way of my screen setup, Sherry, why don't you go first?
Sure. Hi, everyone. Great to be with you today. My name is Sherry Manuel. I am the Chief Commercial Officer for our imaging business across US and Canada at GE Healthcare.
All right. I love it. All right, Lisa, you are next on my screen.
Hello, everyone. I'm Lisa Wood, and I'm Executive Director from Hancock Health, and I also serve on the AHRA Education Foundation.
All right. So last but not least, Jake, why don't you share a little bit about yourself?
Thanks, Jason. Hi, everybody. It's Jake Poore. I'm a cultural architect. I've been working on that for 12 years at the Walt Disney Company and for the past 24 years doing it in medicine. And happy to be here and share some best practices and most importantly, some lessons learned.
I love it. All right. So why don't we dive in? I'd love to start here. I mean, obviously the whole conversation today is going to be about culture and how we create that culture. And I'd love to kind of step here. The nice thing is we have three different perspectives, right? We're going to have a corporate perspective from Sherry, as well as Jake, sort of your experience of traveling around the world and seeing these things. And Lisa, you're living it day to day in the trenches and go there. So maybe we start with you, Lisa. Maybe you just talk a little bit about how you see team engagement and culture really being, an important driver of sort of how you are as leader at your organization, patient care, those kind of things.
Yeah, for sure. What we want to see is a lot of team communication. We want teams supporting each other. We want teams, which you have high communication, you're going to have high staff satisfaction, which is going to lead to better patient care, better safety. What we find, though, sometimes with the communication is, we may have the me person versus the we people not wanting to be a team. So it's like, how do we deal with those people, Jake? How would we take that and change that around to make it a stronger communication? What do you do with the naysayers, per se?
Great point, Lisa. I think there's a number of levels, and it starts at the C-suite, right? Number one, who are we? Where are we going? I'm unpleasantly surprised how many frontline employees have no idea what the organizational brand is. And yet it's on the radio, it's on the billboards, it's on direct mail pieces, but we don't know. If we don't know what the brand is, what the brand promises to our community, how are we going to deliver it in our radiology unit. Number two, we don't talk about it. So if we don't know it and we don't talk about it in daily huddles, team meetings, if it's not woven into our systems and processes, it's not top of mind. If it's top of mind, how can I put it into my daily routines of how I do CTs, MRIs, and CAT scans, mammograms, right? And the last thing is, I think we need a support system of carrots and sticks. Every organization not only has a what, and the why it's the how. So when I do something that adds value to the organizational team effort versus the me culture, can somebody write me up in a good way? Because usually writing someone up is negative or punitive in medicine. Mm-hmm. And the other is there accountability if I don't walk the talk, if I'm having a grumpy day, if I'm throwing my colleagues under the bus, either in the hallway or in the unit right in front of guests or patients. So those are just some ideas. I think those are some of the underlying potholes that keep cultures from growing and thriving.
Jake,
I'm going to pick up on that, but Sherry, I want to have you weigh in a little from your perspective.
Yeah, no, thank you. So Jake, couldn't agree more. And Lisa, definitely communication. I think, Jake, to what you were saying, when we spun off as GE Healthcare as our standalone company 3 years ago, Pete Arduini really laid out, and our company laid out a purpose statement, right? To create a world where healthcare has no limits. And so from that perspective, having that cascade across the organization, knowing what our purpose is, knowing that you can feel safe to say maybe you're not having your best day. So, you need to take a break, or maybe it's not best that I'm on this particular call, but overall it's how does that purpose drive through the organization, and as leaders across the organization, that we're emulating that day in and day out so that it's known and fed throughout the entire organization. And then again, just that cross collaboration opportunity to communicate and know that, we're all in it together. And that helps us show up best as we're working and connecting with our clients, and knowing our purpose and our focus is really about the patients at the end of the day. And we all share that same purpose across healthcare.
I love where you guys are going. I think you're all hitting on that common theme, is that through leaders from the top down, ensuring that everyone that comes in understands where we're going, our direction, our mission, our values, and then you reinforce it. And Jake, I think you used to share with my team, find people doing things, and it wasn't feeling wrong, it was find people doing things right and reinforce that, right? We used to joke around about forced rounding in the hospital, right? So people had a round, and we'd say to the teams, go out there and round, and your objective is to find people doing things what? And half the time, the leaders would say, wrong. And the teams would say, yeah, they're going to come rounding and tell us what we did wrong. And we said, we got to reverse that, flip that over, and find people doing things right. Just reinforce that culture. Maybe, Jake, you could speak to this. I know one of the threads I picked up on here was just about you saying that everybody knew I'll use your phrase, the true north, right? Maybe you just pick up on that a little bit. About how do we reinforce that? How do we make sure people understand that more than just saying it, right?
Yeah, I mean, you and I did this at Bay State Health up in Springfield, Massachusetts. You also localize it to your department. We can talk about that later because, if people don't know the why, the what they do doesn't always matter. And everyone on this call right now, I guarantee you, is struggling with frontline employees leaving for $1 or $2 more an hour. You're blaming it on you're waging a wage war? Well, shame on you. You haven't connected them to a purpose. Sherry just told you she works for an organization that has no limits. Lehigh Valley Health was just acquired by Jefferson University Health, and they had a wonderful campaign, Your Health Deserves a Partner. And my friend Jack Dunleavy and I helped redesign new employee orientation, and we would just say to the new employees, what would a new partner do? What would a great partner do in this situation? If you did something as a partner for a patient or a colleague, and you're not sure if it's right, if you are doing it as a partner, you're always going to be right. So I think, the best brand I've ever seen is MD Anderson Cancer Center in Houston, right? We make cancer history, right? With the slash through the cancer. Talk about, and going back to what Lisa said, the most important word is not history or cancer, it's we. It's like the janitor in 1961 that John F. Kennedy stops at NASA and says, what do you do here? And the guy says, I'm part of a team putting a man on the moon by the end of the century, Mr. President. What? You're just a janitor. You go to Methodist In 1971, Life magazine photographer and reporter stopped this janitor in the hallway and said, "Excuse me, do you work here?" Yeah. "What do you do here?" "Oh, Dr. DeBakey and I, we save lives together." They're there to take a picture of Dr. DeBakey, the heart surgeon, to put on the cover of a magazine, yet they wrote an article about a janitor who knows his purpose. So as leaders in healthcare, our job is not to take care of the patient. Our job is to connect people back to purpose so they know their why. And once they know their why and elevate it to a calling, they'll not ignore the extra $1 or $2 or $10 more or the traveling, carrot, but they'll sure think twice about leaving an organization that's really connected to purpose.
I think, Jake, one of the things that's really important as you're driving toward that culture of purpose and why across the organization is the recognition of those that are doing it, right? So not just recognizing great work day in and day out, but the how behind what they're doing and how they're doing it. And so really having either during your meeting or as you start the meeting, celebrating at the beginning, someone who has shown behaviors and the purpose behind what they do, right? And how that impacted the patient or made the organization better or drove someone to want to come to your healthcare system. So that I think really having that focus around recognition as leaders is so important because you get bogged down on the day-to-day and it gets really, really easy to forget and just focus on, how hard we're working and the amount of work we have to do, but taking that time to pause and celebrate where great behaviors are being shown.
Yeah, that's a good point, Sherry. And one thing that we do here for recognition, which is a little different, it's the patients recognizing our staff. We hand out thank you cards to every patient and anybody involved, starting from the office person and the technologist, transporter, whoever is going to sign that card. And we have a dedicated phone line on the card for patients to call back with any responses. And I'm telling you, staff love this. And if they do get a call, they go on a monthly contest for inspiring excellence. And then we pick winners each month. So this has been a huge recognition in our area that we really like.
I love that. So that's a way they get recognized directly by the people they're taking care of. And then you get to share, Sherry said, you get to share that example of why, because the patient probably explained why. Because if they take the time to write something, that means it really was impactful, right? It was more than just a moment or you're filling out a survey, right? They're actually writing a reason. I love that idea. That's fantastic. So some of the stuff, as you say, we're going to talk through a lot of this. And Jake and I have talked over the years, and I think Sherry, at least, we talk the same way. A lot of this stuff seems very basic, right? The question is then, why doesn't it happen more often, right? So maybe I'm curious, like, Lisa, from your end, like what you're seeing some of the barriers day to day. And then when you're done, I'd love to hear, Sherry, your perspective too, because you're in a different environment, right? So maybe working with more virtual people and you have employees and your team members kind of spread out all over that's a different challenge of creating a culture there. Now, Lisa, I know you have remote folks, but obviously you're in the hospital, you're walking around, you're seeing those people, they're interacting a little more directly every day. So maybe the two of you I'm so curious of perspectives there, and then we'll have Jake maybe pick up on some of the things you're hearing and share some thoughts there. But so Lisa, you want to go first? Maybe just from I call it more to the day to day.
Yeah. So some of the barriers, that we're seeing are a lot of people are short staffed. We all struggle with that and we're very busy. It's a hospital setting, and being overworked causes a lot of stress on the team, which in turn, we really need to do a lot of staff appreciation. We have Motivosity here, which is like a Facebook really, for healthcare. So we do go on and the teams can, like the CT tech can thank another CT tech. "Oh, we were really busy during this time. Thank you so much for helping me." And then seeing everyone come together. I think if we have good communication, we're all going to work together. But short-staffed, can really be stressful.
Yeah, I completely appreciate the challenges, especially too as you're trying to care for the extremely increasing number of patients coming through your doors. So it just kind of intensifies that situation. I think the area of the virtual connections, it's really hard, right? So, we all felt it during 2020 and into 2021, but how do you, I think where we focus specifically is trying to make that one-on-one connection. So yes, there's the ability, you can have team calls. It's the holiday season, you can have fun, ugly sweater, virtual parties and, get people online and on camera. But it really is making that one-on-one connection with each of your team members to understand what they're going through, what their situation is, what drives them, what motivates them. Because at the end of the day, they want to feel connected, and they want to feel like they're heard and that they are in a place that they love and they're thriving. And so it's picking up the phone and just calling and starting the conversation with, hi, how are you doing? Like, how are you doing today? How's your family? But just making those connections where you can. And again, it's not letting the day-to-day hustle get in the way of taking those moments. And again, either recognition or just making the phone calls. I think too, there's a lot about the background support staff, right? Like our field engineers, our applications team members, even the engineering team that's designing and developing the technology. We don't always make those connections with how what they're doing is connecting in. And so trying to do a better job at that, but it's not easy. The virtual connections are tough, and you have to be meaningful about them.
Yeah, I'd like to start a little bit more about the consequences, Lisa, and I totally agree about being the short staff. I think we need to dig more into that data. Why are we short staffed?
Mm-hmm.
I think we have to be brilliant on the basics, right? We've got to make sure that this has got to be pervasive in all departments. And I think we've done, I think we can do a whole lot better. I'll give you a great example. I worked at Kaiser Permanente in Santa Clara, California. Huge turnover in the sterile processing department. The people who clean the instruments, sterile instruments, put surgical kits together. We can't do surgery without them. Why are they turning over? Well, I spent a day with them. You know what they call themselves? Glorified dishwashers. Talk about self-deprecation, right? You're more than what? And I said, how many of you have ever seen your surgical kit in action? There's 60 people. We're doing a team meeting. No hands go up. I go, well, I got here a 9-year-old tonsillectomy. Who wants to go? 3 hands go up. I got an open heart surgery, 56-year-old male. Who wants to go? 3 hands go up. I said, all right, number 1, you can't faint. Number 2, you have to tell a story when you come back. And what's the number one thing the surgeon said when they found out that 3 people in the OR were from sterile processing? He said, thank you. Or she said, you guys do great job. I know and you're back to your point, Jason, I only get to see my boss or hear from my boss until I do something wrong. Surgeons only call sterile processing when they're missing something. So we've got to connect people back to not just purpose, but to see the impact they make in the world. Right? What are the consequences? Well, let's list them. 400 physicians committed suicide last year. Why? Because they're depressed, right? Isolation kills. We need a buddy system. We need a partner, a wingman, right? We don't have that in medicine. These people are literally in a room by themselves with the patient. We got to connect them to someone, a peer, a mentor, a coach that you can empty out this negativity, not take it home with you. The average recruiting cost for a nurse in America is up to $82,000. And if it's a surgical nurse, it's $137,000. It takes 81 days to replace them. What impact, Sherry or Lisa, is that making on your team when we're short-staffed for 81 days, right? Everybody gets burned out. So we've got to be brilliant on the basics. And that's what I want to talk about in 2026. So the leader's job, number 1, is caregiver first. Mm-hmm. Take care, fill their bucket first. If you don't do that, they're empty. Their battery is not charged, and they're not able to take that same energy out into the field, into the OR, pushing the wheelchair, bringing the next food tray, or doing the next surgical kit. So I think we've got to make sure that I want to give you one last quick anecdote. There's a guy who wrote a book, Ken Blanchard wrote a book, a service book in the 80s. I can't think of it off the top of my head. But he had a great analogy that I think we should all think about as we move forward in 2026. And this, you have a culture. That's not the question. Is it a culture with intention, or is it a culture by default? And he said, organizational cultures are like a river, right? But it needs banks. Okay, a river without banks is a puddle. I disagree. If you take the banks away, like in New Orleans during Katrina, you got yourself a tsunami, right? But what are the banks? The banks are what we stand for, not just our mission, vision, and values, but the behaviors. What does it look like in our unit? The other bank is what we won't stand for. This is the graffiti that I hear all around the world. To your point, Lisa, I just came back from Saudi Arabia. I was rounding on patients and they told us we're short-staffed. How do patients know we're short-staffed? It's because we tell them, right? Well, what you don't realize is when you tell somebody and give them anxiety, cortisol's released in their bloodstream. Their blood pressure goes up, right? Their veins contract. It's harder to hit the vein when you're trying to get the IV. It's a lose, 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 lose. And I think moving forward in 2026, we need to go for the baseball analogy, right? We win games by base hits. So one patient at a time, the N of one, right? Not one size fits all, one size fits one. We're going for singles. Now, if we're lucky, when you give, you get. That's a double. The patient wins. I feel great doing it. The triple is when the team wins. We tell those stories at team huddles. We celebrate each other, to Sherry's point, in mission moments. Great. The grand slam is when everybody wins. The organization wins, the community wins, the team wins, and the patient wins. That's what we need to go for, but we got to be pragmatic of the how. Everybody talks about what time it is, and I want to know how the watch works. How does it make it tick? We got to get down to little how behaviors, these little micro moments of tools and techniques, so that we can all be on the same page and not just random acts of kindness. Sorry, I went off on there for a moment.
I think it's
the one thing, sorry, Jason, that I wanted to mention. So I love what you were saying, and I even wrote it down. I learned a ton from both of you. The focus around, it doesn't have to be always leadership down, right? There has to be those moments and those opportunities that the team feels empowered to go out and be creative or innovative or do things differently, and then share that. That's another area, again, to give the teams those keys to say, go be great, go do some great things, and then share it. And then that cascades from the bottom up and also connected to that purpose at the top.
Yeah.
I love the comments.
That's where I was going to jump into. I said, we hear a lot about what is the leaders going to do for me? And again, we started that route because it is important that the leaders are emulating it and we're saying the stories and we're taking our vision and we're localizing it and we're reinforcing it. But at the end of the day, where real magic happens is when the team feels empowered to make those decisions themselves. I love, Jake, when you brought up that example of the no just. I had a sign, I think after you and I met, it said, one was, I am they. I can't stand that word when they talk about they. I never know who we're talking about.
Right.
They don't understand. They're not here. They don't appreciate us. I was like, I don't know who we're talking about. I'll be they, right? But the other one was the just. My couriers for our laboratory. They would drive all around and we'd bring them together sometimes. Say, hey, how you guys feeling? You're on the road. You don't really see us all the time. And I'm like, well, I'm just the courier. Why? It doesn't matter what I feel. I'm like, without you, no sample gets to the laboratory. Then no one gets tested. Nothing ever happens. Without you, I don't know what's happening with our competitors. I don't know if we have a busy day or a short day. You're the face that patients and our customers probably see more than the people in the laboratory, right? Because they're down in the basement. You're the one out there in the community. And we had to circle back to say you are essential to the process that's going. Just like your story about the central sterilization folks. That's awesome, right? Because oftentimes you're sort of out of sight, out of mind. And I think it's important that we reinforce that. But when the staff feels that way and they jump in and they do those things and we don't put strings around them, that's when great things happen, right? But that to get there, though, they got to buy in and feel like they're part of that culture and they help develop the culture. Right? Just another sidebar. I was talking to someone new in our company and we were talking about the new values that got pushed out. And here's our 4 values, what we stand for. And they're fantastic. But the question was, were you told those values? Or did you get a chance to understand what those values mean to you and me? Jake, I was telling you the story about how different people have different visions of what's good and what's great. And I was telling you the story yesterday about when I went to the eye doctor, right? And I saw that, that little screen that opens and I can't see the person's face. The person that was in front of me was like, no, this was fantastic. And I'm like, oh, I want to walk in and see a face, see a greeting. I don't want to be talked to through the door or feel that peace. But I don't know, there's so many little elements here I know that we can tackle. And I like what you also said, that it's start with the basics, one small step, right, as we go. So Sherry or Lise, are there anything you guys have worked well that you would share here? Sort of like one example or something? I think, Lise, you shared the way you celebrate and recognize some folks, but any other things that come to mind that either you guys are doing today that you've seen working either in your hospital or her that you want to share just out loud?
Sure. I mean, we've empowered our team to be able to do service recovery on their own. If a patient has a longer wait than normal, we have service recovery. All of our sites have service recovery and they do that on their own. So I think that helps hit it right at the time that the patient's there with them. I'm sorry about your wait. Please go have a Starbucks on us on your way out. That works well.
Something simple.
Yeah.
Doesn't have to be a lot, right? You give them the authority to take ownership and not have to go find someone else. Got it.
Very good. So I'll give a recent example. So obviously year end, we go through performance reviews. One of the things that we changed up a couple years ago was, again, focusing on performance around key metrics, but also having a section deliberately stating behaviors and how you do what you do. So I'll circle back to what I had said at the beginning. We put that into practice through a year-long review. And again, it's focused on personal, professional growth as well as performance. But having those touch points along the way and meaningful discussions throughout the year, both on performance and behaviors, I think helps recenter the team member's mind around, okay, I need to think about how I'm doing, what I'm doing, and again, tying it back to the purpose within the organization and what their why is. So I really like how we've created that annual process and making it deliberate and not just focusing on, okay, at the end of the year, you have performance reviews and it's like this nervous situation, but you know where you are along the way and you know different things and different team members or mentors that can help and we put into support as well as leadership training and opportunities.
Sure. I love that. It sounds like, again, that's you also going back to the fact that some people say we don't have time. You're like, yes, we do. We're going to make time for what's most important. And what you're basically driving and sharing is make time throughout the year to make those connections and take the time to talk to folks along the way. Right. And that makes a huge difference versus, like you said, the surprise and the once a year. Surprise.
Or questioning, how am I doing? Because then that leads to
that's right.
Unintended consequences of, accountability and lack of performance if they don't know how they're doing and what they're doing.
Jake, were you going to jump in?
Yeah, I was going to tell you the big aha for 2025 for me just happened last week. I was teaching workshop. It wasn't last week. It was 2 months, 60 days ago, to 17 clinics called Advent Health in Tampa. And it hit me, the epiphany was, we've been working on care for so long, right? Clinical care, I care for you, but it's really me caring for you. It's a monologue, not a dialogue. At the most, we're caring out loud. Let me tell you what I'm going to do to you. Let me tell you why I'm going to do that. Let me tell you what the test I'm going to do. And the epiphany was, we've got to move from care to connection. And what does that mean? And this is the key here. This is the key of somebody who's been building and changing cultures for over 30 years. Is we got to give the team and the physicians some agnostic tools, authoring tools that they can make their own. Okay? So first, I gave them the destination. We're no longer just going to care for patients. I talked to physicians recently, and they said, the reason we're burnt out is because we've turned into transaction robots. And that is soulless work. It erodes the soul. So you go home depressed and you don't want to unload on your spouse. If you do, now you've got a bad home life too. And it's like a lose-lose, right? We've got to connect to connection, not just care. And that destination now, we give them some simple tools. So 3 out of the 17 clinics, and I'll start with the best, OBGYN was at the first percentile. For those of you who don't know patient satisfaction, that's the worst, right? That's the outhouse. We want to go from the outhouse to the White House, right? Well, they were at the bottom, right? They didn't know why, and we gave them these simple tools. Human, business, human. You guys know this tool, right? Human first. Good morning. Welcome to OBGYN. My name is Patty. Can I help you? Human, right? Business. Can I get your driver's license? Can I get your insurance card? Human. Hey, what do you like to do when you're not here in the clinic? What's your thing you want to get back to after this hysterectomy or whatever you're here for? And they tell us. Then we hand that off to the medical assistant, and the medical assistant no longer yells the name out. They go up to the front desk and say, hey, where's Mrs. Jones? And she walks out to the person. Oh, Mrs. Jones. Oh, I understand you're a runner. You like to hike in Colorado? I have a place in Beaver Creek. And now we're connecting down the hallway. Human, 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 human. We do our business. We weigh them. We do the blood pressure. We then hand off to the provider. The provider pulls the intake sheet off the door. On the back of it, it likes to run. It likes to ski in Colorado. The provider walks in on the human and says, hey, I just got back from Vale, is Beaver Creek close to there? What? Yeah. And they start connecting. Again, time, it does take a little time, but now we're building relationships. And you're no longer a clinic, you're my clinic. And by the way, the patients in 60 days gave them a reward of likelihood to recommend from the 1st percentile to the 99th percentile. In hematology, it was the 7th percentile to the 99th percentile. And then in another department, I can't remember which was, they went from the 19th percentile to the 99th percentile. Why? Because now we share these things and they take on a life of their own. Now the providers are not just saying, get dressed and go back to the front desk. They walk them to the front desk. These little micro moments of wins collectively together is that grand slam we talked about. Not only everybody wins, but the community's talking about these clinics called Advent Health, and you shouldn't go anywhere else.
I love that. And that's a great tee up, by the way. I'm going to lead us here about why AHRA, the foundation, GE Healthcare, we reach out to you as sort of a program that we're looking to launch for 26, right? And we talked all about connections and the power of what that is. And I love how you just framed that from, yes, we need to take care of folks. Yes, we're busy. Yes, there are things going on, but to really transform and go from, for lack of stealing the phrase, good to great, but going to that next level of exception, right? You make a connection. And that's just with the power of that. So maybe we'll just do this. So at least maybe we'll start with you, and then from the foundation side, AHRA Foundation on your side, like, can you speak to why you're so excited for us to be supporting this program and sort of why we're getting behind it, putting dollars in? And then I'll transition to you, Sherry. Maybe you can speak to how you saw that from the GE side. And then Jake, maybe a little preamble, kind of reinforcing what we're going to be launching into next year, which I could not be more excited for. It's something I've been pushing for since I've known you for about 10 years, Jake, and since I've been here in this new role the last 2 years. So, Lise, you want to start there?
Sure. Yes. The Education Foundation is excited to offer this to all of our members. It's a huge benefit. I've seen Jake's presentation in the past and benefited from it as well, bringing it back to our institution. I would like all of the members to be able to get the same experience. It's a great opportunity for all of our members. And like I said, we're really excited to be able to have Jake's presentation for 2026. Very excited.
Yep. So from the GE Healthcare side, extremely excited to sponsor the Education Foundation, and specifically through this program. I also have heard Jake. I was able to introduce him and then sit through his closing panel a couple AHRAs ago, and just took a ton back to our teams as well. So really excited there. I think everyone knows right at the core, of Jack Welch, Jeff Inelt, now Pete Arduini, and Larry Culp, of course, at the corporate board. But leadership has really been at the core within GE Healthcare, and we find ways to focus and build programs around leadership development. And we think it's so critical, right? As you think of leadership development, mentorship, promoting best practices, and really driving across the healthcare industry, the opportunities to raise new leaders and leaders across the organization. One of my favorite quotes is, you don't need a title to be a leader. So again, how can we have all of these leadership behaviors cascade throughout the organizations and throughout the healthcare industry, within providers and other industry partners? So we are thrilled to be sponsoring the upcoming Education Foundation program, and really hope that so many of you take advantage of this program moving forward.
Fantastic.
Well, I'm absolutely honored to be part of this. For those of you who are listening or wondering what the heck we're talking about, for 12 months next year, one day a month, probably towards the end of the month, maybe on a Thursday, we're going to spend an hour talking about one tool that's simple. In 1938, Harvard University voluntold 284 sophomore students, white men. They said, we're going to follow you the rest of your life. And we're going to find out if you're happy, you're sad, you're alive, you're dead, you're fat, you're skinny, you're rich, you're poor. We're going to follow you. At the same time, they wanted, these are rich white kids. They wanted to get a better mix, so they found 465 other inner city kids they're also going to follow. So this study's been going on for 87 years. Are they married? Are they divorced? Are they alive? Are they dead? Are they happy? Are they sad? And the bottom line was, isolation kills. Relationships makes them thrive, right? But again, that's what time it is. How do we build relationships? Every month next year, we're going to spend an hour or so talking about one tool to build better relationships. Leaders with staff, staff with patients, patients with volunteers, volunteers with the organization. So this is not just tools that'll make it a better workplace, but these are tools that'll make better friendships, better spousal relationships. These are agnostic to all your relationships. And I'm thrilled to share them with you, and also to hear from you as our listening audience to say how you have adapted and adopted it to your workplace, and hopefully with good outcomes or made them better. Jason?
Yeah, I don't know. I'm so excited for all of these pieces. So I really appreciate the three of you today sharing some thoughts and perspectives. I could sit here all day long, and I think our listeners would love to listen to it too. That's why we had the program, Jake. So we'll have that going. And I know that some of those sessions are going to be interactive as well. We're going to create opportunities for people to jump on, share their stories, ask their questions, talk about their challenges, what's working well. I think that's the power of this, this community that we're creating within AHRA. So maybe just a real quick wrap up. I just want to make sure that if people have any questions, they want to reach out to any of you. Lise, is there a best way to reach out to you? Maybe just slowly tell them your email, or is there a way to get there? Maybe just share that.
Sure, I sure can. My email is lwood@hancockhealth.org. Pretty easy one. LWOOD@hancockhealth.org.
Perfect. And Sherry, how about you?
Awesome. Probably easiest is either email or LinkedIn. And my email is sherry.manuel@gehealthcare.com.
Perfect. And Jake, I know they can find you on LinkedIn and stuff. Is there other place you'd want them to search you out?
My whole life daily is, and if you want to know anything about me, I write pretty much every 3 days is a new article on LinkedIn. All my contact information is on LinkedIn. You can find everything, my website, my email, and I usually will respond within 12 hours, if not 24 hours on email.
I love that.
And one little note, I want to say, hey, Jason, I want to thank you personally for your friendship, your love, you brighten this world, and your advocacy to make sure, that we could do this. And Lisa and AHRA Foundation, thank you for sponsoring this. And thank you, GE Healthcare. I mean, Sherry, I'm so glad to be working with you over the last couple of years and sponsoring this. It really means a lot. Thank you. We're going to make this world a better place. Can't wait to share these tools with the world.
Thanks for listening to Medical Imaging Matters, a podcast from AHRA, the Association for Medical Imaging Management. If you have enjoyed today's episode, please be sure to subscribe, rate, and review. AHRA is proud to be the trusted association for medical imaging management professionals, offering career development programs, a comprehensive selection of educational conferences and seminars, networking opportunities, award-winning publications, the certified radiology CRA credential, and so much more. To discover all AHRA has to offer, visit our website at ahra.org. Until next time.